Who regulates international ophthalmology standards and practices? Have you ever wondered who is behind the standards and practices in ophthalmology around the world? International ophthalmology standards and practices are shaped by a mix of global health organizations, professional societies, and regulatory agencies. Together, they create guidelines, promote research, and oversee clinical practices related to eye health and diseases, including glaucoma and macular degeneration. At the forefront is the World Health Organization. This organization plays a vital role in establishing broad health standards, including those specific to eye care. The World Health Organization develops international guidelines that focus on eye health, disease prevention, and treatment protocols. Their goal is to reduce blindness and visual impairment globally, addressing major causes of vision loss like glaucoma and macular degeneration. Professional societies also play a key role in this framework. For instance, the International Council of Ophthalmology provides essential education, training standards, and practice guidelines for ophthalmologists worldwide. They work closely with regional and national ophthalmology societies to ensure that standards are harmonized and that the quality of eye care is enhanced. On a national level, regulatory agencies like the United States Food and Drug Administration and the European Medicines Agency oversee the regulation of ophthalmic drugs, devices, and clinical trials. These agencies ensure that treatments for eye diseases are safe and effective before they are approved for use. They also monitor ongoing clinical practices to maintain high standards. Moreover, scientific journals and multidisciplinary medical platforms contribute significantly to the development of standards. They publish peer-reviewed research that informs evidence-based practices. Editorial boards made up of experts in eye health ensure that the data published is of high quality, which helps shape clinical guidelines. In practice, international standards are often implemented through consensus guidelines created by expert panels. These guidelines are typically endorsed by professional societies and health authorities. They cover the diagnosis, management, and treatment of conditions like glaucoma and macular degeneration, focusing on evidence-based approaches and patient safety. In summary, the regulation of international ophthalmology standards and practices is a collaborative effort. It involves the World Health Organization, professional organizations like the International Council of Ophthalmology, national regulatory bodies, and the scientific community. This multi-layered approach ensures that eye care practices around the world are based on current scientific consensus, promoting effective management of eye diseases while prioritizing patient health.